Good morning, Dr. Coburn. I'm a physician in Colorado. I want to respond to your video and to Barack Obama's health care plan. What I'm not hearing from either side is rational thinking. Everyone knows that there are large numbers, whether that's 30 or 40 million Americans that are not covered by insurance. The numbers are huge, and those who argue that large tax increases will be required are ignoring the fact that we already pay for those people's care. As you well know, they show up in the emergency rooms. The hospitals then shift the cost from those patients to the patients like you and I who are insured. The second point I want to make is that I'm tired of your side in particular, and I'm a registered Republican, making government out to be a bad organization. There are two things wrong on the healthcare side of payment. First is the VA, and for that matter Medicare, actually do a fairly good job of covering their lives and giving people a decent level of health care. What's wrong is the insurance companies making profits. As you heard in the hearings this week, the CEO, I think of Blue Cross perhaps, made $10 million last year. You cannot have a for-profit health care system that does things in a rational way. I take care of Medicare patients. Medicare takes the right approach to evaluating new technology, for example, CT PET scans. I can order a CT PET scan. It's done for quote-unquote free if I fill out a form that allows a panel of physicians like you and I to evaluate whether that PET scan actually saves money or in the long run is unnecessary and costs money. Finally, I'd like to say that the U.S. is spending far more than any other industrialized society to take care of its people, and we get less good health care. In the long run, the way that the other societies control their costs is through rationing. Neither side has admitted to this. Rationing is necessary, and I'll offer you two ways that we can move forward. First, make health care a non-profit society mandate. Take profit out of it, and you will no longer have insurance companies increasing their prices on Wall Street stock by denying coverage. The second is talk reasonably about rationing health care. Allow Americans, whether it's through private insurance that's nonprofit or through government-sponsored insurance that's nonprofit, to have a decent, low-level but agreed-upon safety net of health care, and then let those who want Cadillac plans or whatever pay for them. I don't think we can go on putting drugs in patients that cost $60,000 a year for an extra 2 months of life. I'm delighted that the pharmaceutical companies can come up with those kinds of drugs, but I don't think the insurance companies and our government should have to pay for them. If patients find that those 2 months of life are worth that kind of price and can pay for it, that's fine. But I don't think those of us with insurance or those of us who have Medicare should be forced to. Thanks for listening, and let's bring some real rational talk to this discussion rather than the bitter, big government kinds of talk that is, and talking points that are found in your video. Thanks.